I want to tell you about the very first test that I've done in my pharmacy for a patient. Now, this patient is well known to me as a patient that suffered of chronic headaches and fatigue, as well as gastric side effects from her medications. She's went through a number of tests with specialists, scopes, and everything to determine what could be the reason for her health condition. She would have headaches on a very frequent basis, almost daily, week or weekly, and very little of the medication worked. And after taking the medication, she felt worse. I suggested to her to do a pharmacogenomics test, and we did so. When we got the results, we actually found there's a number of factors that plays a role in her health. We realized that she is a slow metabolizer on specific medication, which means that she will react in a specific way. Which will give her toxic effects. But more important, the secondary finding that we had found with her testing was that she has Gilbert syndrome. Now, Gilbert syndrome is a syndrome that will give you mild jaundice on a frequent basis. Now, specific medication that will get metabolized to the liver will have a toxic effect on this patient. And when we looked at the medication that she was taking, most of the medication she took was working on her liver. And that resulted in her having more severe jaundice and guess what? Headaches as well as nausea. Through small interventions, we were able to change the medication without necessarily have to do any script. We took away the pain medication that worked on the liver, and we gave her a short-acting pain medication, that non-steroidal anti-inflammatory that she could take whenever she had a headache. Within 1 week, she reported back that the headaches were better. And in the past week, she visited the pharmacy again and advised that she only had one headache the past month, which clearly shows that the pharmacogenomics intervention was a great success in this patient's life. She's now able to have a normal body function. She's able to do a lot more things with her family and not have to suffer of this constant nausea, jaundice symptoms, as well as constant migraines and headaches.